Robertson.
Thank you, Mr. Speaker. My question is to the Minister of Health. Have hospital admissions for children with respiratory diseases and infectious diseases increased over the last 3 years? If so, by how much?
The Honourable Tony Ryle.
Mr. Speaker, as the member will be aware, there are a number of respiratory and infectious diseases which children can suffer from, including pneumococcal disease, whooping cough, measles, bronchiolitis, bronchiectasis, rheumatic fever, asthma, skin infection and others. I'm advised by the Ministry of Health that hospital admission data for the last year is not yet complete for most of these conditions. However, I have seen the Children's Social Health Monitor 2011 update, which advises that from 2007 to 2010 calendar years, there was an increase in admissions for certain medical conditions for children. At the same time, there have been reductions in rates of others, such as invasive pneumococcal disease, but here in New Zealand, there is more to be done in this important and challenging area.
Supplementary question, Mr. Speaker. Can he then confirm that the Children's Social Health Monitor says that 5,000 more children were admitted to hospital for avoidable medical conditions in 2010 compared with 2007?
The Honourable Tony
Mr.
Ryle.
Speaker, it's not my report, but I certainly read those numbers in the report. I'd remind the member that a couple of those years are part of his government. And what I can also comment to the member is I've also seen the comments of Associate Professor Cindy Kero, who says that the recent update indicates that while these admissions are still increasing, the rate of increase appears to be slowing, with possible early signs of improvement in some groups, potentially Pacific children. Professor Kero puts these improvements down to interrelated factors, two of which she identifies as the Healthy Homes Initiative, and the second is the much better intake of immunisation in the last couple of years.
Supplementary question, Mr. Speaker. Are the authors of the Children's Social Health Monitor correct when they say that children may be suffering, quote, permanent health damage because preventable illnesses are not being treated because parents are struggling with the cost of living, including the cost of getting medical treatment?
The Honourable Tony Ryle.
Mr. Speaker, I certainly would agree that some children are suffering because of a permanent damage if certain diseases aren't remedied. And that's the reason why I was in Hawke's Bay this morning to launch the first of the government's rollout of rheumatic fever programs at the Iron Gate Primary School. This rheumatic fever program, $12 million over 4 years, is a substantial investment targeted specifically at a disease that causes irreparable damage for young children. It's actually been a national health goal since 2001 when it was set under that previous government. But as that member knows, while they set it as a goal, they never did anything about it.
Supplementary question, Mr. Speaker. Does he accept that his removing of the target for district health boards to reduce avoidable admissions to hospital may have contributed to the increase of 5,000 more children being admitted for avoidable medical conditions?
Mr. Speaker, no, I wouldn't agree with that, because in fact in one of the key groups, children under the age of 5, the advice is that avoidable hospital admissions are in fact coming down. The target that the government puts great store on is the increase in immunisation for 2-year-olds, where we've taken it from 73% of 2-year-olds being immunised to over 90% today. This morning I received an email from the Western Bay of Plenty PHO to advise that now 98% of Maori 2-year-olds are fully immunised. And then a few hours later, I received a text from the Eastern Bay of Plenty PHO to advise that they'd hit 94% across both Maori and Pākehā, the highest level ever achieved in those communities.
Supplementary question, Mr. Speaker. Will the Minister reinstate a national health target for avoidable hospitalisations in light of the fact that 5,000 more children were admitted to hospital for avoidable medical conditions in 2010?
The Honourable Tony Ryle.
Mr. Speaker, the government's got a number of key preventive health measures that impact positively on children. The first is immunisation, where we now have...
A point of order, Grant Robertson.
That was, Mr. Speaker, a very direct question. It asked if the Minister would reinstate the target. That was the question that was asked.
A point of order is being called. To avoid uncertainty, I'll invite the member to repeat his question, because I am still struggling to hear accurately today, and I apologise for that. The member may repeat his question.
Mr Speaker, will he reinstate a national health target for avoidable hospitalisations in light of the fact that 5,000 more children were admitted to hospital for avoidable medical conditions in 2010?
The Honourable Tony Ryall.
Mr Speaker, no, I'm not going to make it a national health target because the government has a number of health targets already specifically targeted at good health promotion and prevention for children. The first of which is immunisation, where we have closed the gaps where that party opposite talked about doing a better deal for Maori and never achieved it in 9 years, and we have closed the gap, and in many parts of New Zealand Maori kids have a higher immunisation rate, and the second rate, of course, issue goes direct to respiratory disease, and it's the work that we are doing to stop smoking, which is being internationally recognised.
Point of order. Point of order. Grant Robertson.
Mr Speaker, I seek leave of the House.
Before I go to the member, now look, I say to the Deputy Leader of the Opposition, who's been a little bit too vociferous today in her interjecting, she heard her colleague call a point of order and kept interjecting across the House. I'm finding it very difficult to hear because of these cousins on each side of the front bench here expressing cousin affection for each other, and if they could, they're certainly not, so if they could, order, if they could desist, it would assist me hugely. Grant Robertson, point of order.
Point of order, Mr Speaker. I seek leave of the House to table a segment of the Children's Social Health Monitor entitled Hospital Admissions and Mortality with a Social Gradient in Children that shows that 5,000 additional children were admitted to hospital with avoidable conditions in 2010.
Leave is sought to table that document. Is there any objection? There is no objection. Question number 5, Dr. Russell Norman.
Thank you, Mr Speaker. My question